Diego. This is Dr. Shumard with Integrative Wellness Center of San Diego. And today I wanted to do a quick video for you guys on a super important topic and regarding type 2 diabetes. But before we do that, we'll let a few people come on to the video right now to see who's going to be joining us today. And I think you guys are going to really enjoy this one. It's a very important topic that we see quite often happening in the office on a regular basis. Before we do that though, what I want to do is want to share, as I always do on many of these live videos, a quick amazing little story that happened just recently. One of the conditions that we work with in our office, besides type 2 diabetes and thyroid conditions, autoimmune diseases, is we work with cognitive decline. And recently we've been working with this patient. It's a male, and one of the problems that he was dealing with was what's referred to as a biotoxin. Now, I don't want to get in too deep into that right now, but basically just think of it as a pretty major toxicity scenario that was contributing to his brain problems that he was experiencing. Well, after a few months, I think it was about 3, maybe 4 months of working with him, we were able to clear that, and he has been seeing some significant improvements in his brain function, so as his family. It's been just amazing to really see the transition of this patient. And what I might do in one of these follow-up videos is do more topics in regarding to cognitive decline, Alzheimer's, and dementia. But today's video is going to be a really important video that I think many of you will really enjoy. And potentially you may be experiencing or suffering from this problem, or maybe someone in your family, and this information could be really helpful. So I'm going to ask that if this information is helpful, that you share this information, share it to your friends, your family, because it very well could be what could be causing some of their underlying problems of why they're not getting better. But in type 2 diabetes, one of the common things that we see, or we know that is the contributing factor to someone's inability to regulate their blood sugars. Because let's go back to that again, because with type 2 diabetes, it is an acquired scenario. It's the insulin resistance, where your cells will no longer accept insulin, and your body can't use the sugar that it produces from food as energy. And that's pretty much the most basic fundamental function we should be able to do as human beings, is eat food, convert that to sugar, and then use that sugar as an energy source to allow us to function all day long. Well, where does that process happen? Well, where does the absorption of food happen? And that should be happening in the gut, in the intestinal tract. And one of the most common things that we see, because we know that the intestinal tract or the gut could be a contributing problem to why someone can no longer regulate blood sugar. Now, maybe some of you who are watching this right now have never heard that before. You didn't know that blood sugar issues could be coming from a poor functioning gastrointestinal system. And many of the patients that we work with in our office will have GI problems, right? Constipation, they'll have gas, bloating, diarrhea, burning. They're taking medications like omeprazole or some other types of medication to help stabilize their stomach and gut function. Well, and some of them actually have a couple other problems, right? They're not digesting their food. Their food's coming out in the stools, or they just feel like not really so great after they eat certain types of foods. Well, many of those people are suffering from a condition called leaky gut. Now, some of you may have heard this condition called leaky gut, but maybe don't know exactly what is going on. It's such a common thing thrown around in functional medicine and nutritional offices, naturopathic offices. But what I really want to do today is explain to you what leaky gut is, so you truly understand, and why it's such a problem for so many individuals dealing with this condition. And in some individuals, it's their main issue they're dealing with, which is contributing to their diabetes. And they're able to get off their medications, they're able to stabilize their blood sugars, and essentially become non-diabetic once this problem gets fixed. But essentially with leaky gut, the intestinal tract, which is, if you laid it out, it's a super long tract, but its main job is to digest and absorb the food. So take the nutrients the body needs and get rid of the stuff that it doesn't need. So essentially what happens is there's an absorption aspect where the body will, or the intestines will absorb the nutrients into through the wall of the intestines, and then goes beyond that, which is just beyond that is the bloodstream. Well, in some cases, over time, that barrier of the intestinal tract starts to get small or thin. So an example I could use is, imagine you're looking at Berber carpet, right? Some of you may know what that is, that thick carpet back in the day, mostly like 70s, early 80s, where the carpet kind of go between your toes. So that's like a really thick lining of what the gut should look like, rather than industrial carpet is really thin, right? And that's what we don't want. And so as the thinning starts to happen, we start to get these larger molecules that should not be going through the gut lining. So another analogy I could use is, imagine you were using cheesecloth. Many of you may know what that is. And when you use cheesecloth, only the small stuff is going to go through, the very microscopic, and everything that's larger will be caught by the cheesecloth, so you can remove that, or strainer type situation. The intestinal tract is no different. So when the lining starts to get really thin, we start to get larger, what are called macromolecules, coming through the barrier, which should not be happening. Because when you get these larger macromolecules coming through, number one, you're going to start to create an inflammatory response, and it starts to create inflammation in the gut, which can create things like inflammatory bowel disease, colitis, those sort of things that some people get diagnosed with. They're just given medication to treat the symptoms. But in reality, when these large macromolecules start to come through, as I mentioned, just on the other side is the bloodstream. And within the bloodstream, you have your immune system. Now, your immune system is supposed to be your protective mechanism. It's supposed to protect you from bacteria, viruses, fungus, environmental factors, things that are going to potentially cause your body harm. And so what happens is these macromolecules come through, and the immune system sees that, even though it's food and good stuff, it sees it as a foreign body and starts to attack it. Now, at this time, when the immune system starts attacking the food, its byproduct is going to be creating what's called an antibody. And an antibody is a memory cell from the immune system to remember that specific item, so then if it ever comes back into the body again, it will destroy it and kill it. Hence why individuals develop what's called food sensitivities. Now, this is a very important concept I want you to really understand, because most people understand allergies. Now, an allergy is a completely different immune response than a food or a sensitivity. A sensitivity is acquired, an allergy you're pretty much born with. It's a different type of immune response. We have what's called an IgE response, or allergy response, or an IgG or IgM. Some of you may be familiar with some of these terms with COVID-19 going on right now, and people being tested for antibodies. But essentially, your immune system's job is to create these antibodies, so then if a foreign substance like a virus or bacteria ever comes back into your body, your immune system will fight it off, kill it, destroy it, and take care of the problem before you even know it. So you're fighting these infections, and your body's doing it without you even having any problems. So, sore throats, runny nose, headache, fatigue, those sort of things. So your body is naturally doing these things all the time. So getting back to this food situation is, let's just say that a piece of broccoli comes through in a larger molecule, and the immune system starts to attack it. So then you start to develop a sensitivity to broccoli. So why is that important? That's important because every time beyond that you eat broccoli, your immune system is going to attack it and start to create an inflammatory reaction. Now, you may not even notice it. You may not have GI pain. You may not have gas or bloating. But what will happen is it'll start to put stress, inflammatory response systemically, and over time, as that happens, starts to destroy more and more of the cells, which then you start to develop insulin resistance or the inability to regulate blood sugar, hence type 2 diabetes. So I want you to understand this, because leaky gut is a very common underlying cause to things like type 2 diabetes. There's many other things as well, and maybe I'll do another video down the road, other problems, but in this video, we're specifically talking about diabetes.